Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Let us try to answer some MCQ in Obstetrics. Choose the one best response. Please choose the one best response and try to answer before me. Okay, I need your brainstorming. I want you think before me and to find the answer. Okay, let us start with the first. In an attempt of vaginal birth after cesarean, contractions suddenly stop. The fetal parts are felt abdominally. Fetal heart sound are 70 beats per minute. What you should do? A. Immediate laparotomy. B. Doppler ultrasound to evaluate fetal well-being. C. Give oxytocin to prevent maternal bleeding. D. Give prostaglandin vaginally. E. Continue close monitoring on CTG. Choose the one best response. The one best response here is A. Immediate laparotomy. Why? Because this is vaginal birth after cesarean section. Of course, there is a possibility of dehiscence of the scar, uterine rupture. Okay? And suddenly the pain stopped. This is happening with uterine rupture. And severe bradycardia of the baby. Fetal parts felt abdominally, easily. So all these are signs there is uterine rupture. So immediate laparotomy, this is an emergency situation. So the best one response here is immediate laparotomy. Let us go to the next. A pregnant lady had a last menstrual period on June 23. So her expected date will be on A. March 30, B. April 7, C. March 23, D. April 23, E. March 7. Please choose the one best response. As you know, we add 7 days and 9 months. Okay? So, if her last menstrual period on June 23, so the expected date would be March 30. So, the best one response here is A, March 30. Okay? Next, hyperextension of the fetal head is found in A. Vertex presentation, B. Face presentation, C. Shoulder presentation, D. Breech presentation, E. Hydrocephalic baby. Please choose the one best response. Okay, hyperextension of the fetal head is found in face presentation. So the best one response here is face presentation. B. Let us go to the next. During delivery, the fetal head follow the pelvic axis as described. During delivery, the fetal head follow the pelvic axis as described. A straight line, B. A curved line, first anteriorly, then caudal. C. A curved line, first posteriorly, then caudal. D. Curved line, first posteriorly, then cephalic. E. V-shaped line. Please choose the one best response. As all of us know, the head descends downward and backward, then change its direction at the level of the ischial spine, downward and forward. So the best one response here is C. Curved line, first posteriorly, then caudal. Okay, go to the next. During clinical pelvimetry, which of the following is routinely measured? During clinical pelvimetry, which of the following is routinely measured? A. External conjugate diameter. B. Transverse diameter of the inlet. C. Shape of the pubic arch. C. Flare of the iliac crest. D. Flare of the iliac crest. E. Elasticity of the levator muscles. Please choose the one best response. Again, A. External conjugate diameter. B. Transverse diameter of the inlet. C. Shape of the pubic arch. D. Flare of the iliac crest. E. Elasticity of the levator muscles. Of course, shape of the pubic arch. So the best one response here is C. Shape of the pubic arch. You should palpate the pubic arch. Normally it admits two fingers and the angle more than 90 degree, and Morris space, dead space of Morris less than or 1 centimeter. Okay, let us go to the next. A 40-year-old woman, prima gravida, at 41 weeks gestation, is presenting in labor with 5 centimeters cervical dilatation. Ultrasound showed transverse lie with fetal back toward the maternal legs. The procedure of choice is A. Tocolysis. B. External version. C. Forceps rotation and delivery. D. Cesarean section. E. Internal pedalic version and the breech extraction. Please choose the one best response. Okay, everybody? The best one response here is cesarean section. D. Cesarean section. She is elderly prima gravida first. She is 41 weeks gestational age. She is in labor and 5 centimeter dilatation, so I can't do internal pedalic version and the breech extraction because the cervix is not fully dilated. Okay? If you are waiting for progress of cervical dilatation, rupture of membrane and prolapse of the umbilical cord can happen. Okay? You can do external cephalic version, but it is risky at such age and elderly primary, and the baby is transverse lie with fetal back toward the maternal legs. So the best choice here is D. Cesarean section, an emergency cesarean section. Okay, let us go to the next. During normal pregnancy, the major cause for lower hemoglobin is, during normal pregnancy, the major cause for lower hemoglobin is A. Low iron stores. B. Blood loss to the placenta and the fetus. Increased plasma volume. C. Increased plasma volume. D. Decreased reticulocytes. E. Hemolysis. Please choose the one best response. The one best response here is C. Increased plasma volume. And this is physiological changes during the pregnancy, physiological anemia. There is increase in the plasma volume. Okay, at 28 years old, prima gravida, at 40 weeks gestation in active labor. At 5 centimeter dilatation of the cervix, she experienced spontaneous rupture of membrane. Then she experienced bloody amniotic fluid and delayed deceleration. There is loss of beat-to-beat variability with fetal heart sound 186 beats per minute. What is your next step? A. Begin antibiotics. B. Terbutaline to slow contraction. C. Emergency cesarean section. D. Ventouse delivery. E. Ultrasound to verify placental position. What is your next step? This is an emergency situation. I have here rupture of membrane with bloody amniotic fluid. Late deceleration means fetal distress. And the bloody amniotic fluid may be placental separation, which causing fetal distress. Late deceleration also denoting fetal distress, and the loss of beat-to-beat variability denoting the baby at rest. And there is placental insufficiency, could be due to placental separation or placental abruption. Fetal heart sound, there is acute fetal distress also because it is more than 180 per minute. So next step would be C, emergency cesarean section. Why I didn't do ventouse delivery to enhance the labor? Because still the cervix is 5 centimeter dilated and it should be fully dilated and head engaged to use vacuum delivery or ventouse delivery. So the best answer here is C, emergency cesarean section to save the life. Okay, let us go to the next. The pregnant woman present at 30 weeks gestation with threatened preterm labor. Lung maturity is unlikely. Fetal lung surfactant production may be increased by a number of factors. The following is clinically useful. A. Estrogen. B. Thyroxine. C. Corticosteroid. D. Alpha-fetoprotein. E. Sphingomyelin. Please choose the one best response. One best response here is C, corticosteroid. As you know, all the guidelines said to give the patient dexamethasone or betamethasone 12 milligram intramuscular and repeat another dose 12 milligram intramuscular after 24 hours to enhance the lung maturity. And you may give the patient tacrolysis to give time for corticosteroid to act and to delay labor. We know that reach the maximum effect after 48 hours. Go to the next, please. When counseling a patient regarding fetal abnormalities during prenatal care, the greatest advantage of chorionic villus sampling over amniocentesis is, what is the greatest advantage of chorionic villus sampling over amniocentesis? It is the only diagnostic test. A, it is the only diagnostic test. B, a decreased fetal risk. C, obtaining for superior cellular sample. D, lack of maternal cell contamination. E, the ability to provide results early. Please choose the one best response. The one best response here is E, the ability to provide results early, because you are doing such procedure, chorionic villus sampling, from 10 to 11 weeks gestational age, but we do amniocentesis after 15 weeks gestational age. So if you need a diagnostic test early for diagnosing of diagnosing of aneuploidy, of course, both of them, amniocentesis and chorionic villus sampling, is a diagnostic test. Both of them is a diagnostic test. That's why A is wrong. Both of them is diagnostic test, but chorionic villus sampling is done early, at early gestational age, 10 to 11 weeks gestational age. Amniocentesis is done above 15 weeks gestational age. So, chorionic villus sampling give me the ability to provide results early. So, counseling the patient and take a decision early. So, this is the best one response is E. This is the end of this multiple choice question. I hope it was beneficial for you. This is my books published on Amazon, textbook, obstetric, textbook, gynecology, contraception handbook, multiple choice question book, medical disorder in pregnancy, and the gynecologic oncology. My 6 books, you can find them on this link on Amazon. I'll put it in a comment. Another lectures, another quizzes in obstetrics and gynecology, and case scenario discussion, guidelines. You can find them on the link on YouTube here. I'll put it in another comment. My best wishes for all of you. Thank you.